Hi everyone, in this video we want to discuss the preferred NSAID, which is an abbreviation for the non-steroidal anti-inflammatory drugs in patients with cardiovascular problems, including ischemic heart disease or heart failure or anything else. If you want to know the best NSAID to be administered in this group of patients, watch this video till the end. Totally, COX-2 inhibitors are not the preferred agents in patients with cardiovascular diseases. But why is that? Because of the imbalance between the production of prostacyclin and thromboxane A2. These two are products of arachidonic acid. Prostacyclin is a vasodilator and antiplatelet which is produced by COX-1 and COX-2. However, thromboxane A2 is the platelet activating factor which is produced by only COX-1. COX-2 inhibitors make an imbalance between the production of these two, which may further lead to overproduction of thromboxane A2, which may further lead to cardiovascular events, including thrombotic events. So, COX-2 inhibitors are not the preferred option in this group of patients. However, celecoxib can be used up to 400 milligrams a day and it's safe. What are the preferred NSAIDs? Naproxen and ibuprofen are the preferred NSAIDs in this group of patients. So, in case of a need for administering an NSAID in this group of patients, these two medications can be used safely. Hope you enjoyed this video. Please ask your question in the comments. Thanks.